Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, Dean of Sama Institute of Health. We are still doing our sessions in patient safety. This is topic 7, Introduction to Methods of Quality Improvement. This is the second session in this topic. So we would like to discuss two continuous improvement method, clinical practice improvement methodology, and root cause analysis. Improvement process, it goes through different phases. Initial phase is the project phase and team, creation of the team and initiation. Then the diagnostic phase, that will be followed by intervention phase. Then we have to measure the impact, and finally, if there is improvement, we need to sustain this improvement. In the initiation phase of the project, first we have to create a team. This team should be representative of all those involved in the process, because these are the people who know the process, who know the gap, and they can give good solution and suggestions, and they are the one who are going to implement it when it become policy and procedures. So the team should based should write its mission statement and objectives, and the team should always consider patient as part of the team member, because patients have some perspective about the care delivery. At this stage, the team should consider the type of measures they want to use. They do that through brainstorming, critical thinking, creative thinking, and sometimes they can learn from other institutions or from the literature about intervention that has been implemented. After we create appropriate team, then the team, they should do some diagnostic test. The team need to ask whether the problem they have identified it worth solving, because some problems are annoying but really they doesn't worth the effort we're gonna do. So the team should determine the magnitude of the problem by gathering as much information about the problem as possible. They need to understand the expectation of the provider and also expectation of the participant and of the administration. And as we mentioned, involvement of the patient important, so their expectation is also important. Through brainstorming exercise, the team can generate possible changes and solutions that can be implemented, and they should decide how they're gonna implement these changes. After we create the team and they run the diagnostic phase, then they go through the intervention. During the intervention phase, they're going to implement plan, do, study, act cycle multiple times. They have, after they have identified the problem and suggested the possible changes and intervention, they need to implement these changes, plan, do, study, act, and they need to measure the outcome to see what is working, what is not working. Uh, Make a plan and predict what will happen, plan for change, who, when, how, where, and then plan data collection. Then do the intervention, carry out the change, document the observation, record the data. Then you need to collect the data again to see the impact of this intervention. If it is doing good to the system, then you're gonna try it in larger scale. If it is not, then you need to make change in the process. And here, this is an example of plan, do, study, act cycle. This is a single test. So they do the first cycle, then they learn from it, then they do another cycle till they make a significant improvement. Some problem and conditions, they need multiple tests at different level, so you can implement them in parallel, and then you have to measure the outcome. Teams, they should ask themselves, did the intervention make any difference? The effect of all changes need to be measured so that the change can be said to truly have made a difference. The goal is to introduce changes that result in sustained improvement. Data measured that of the result should be displayed using different chart and statistical methods. After they get positive results, then they need to try these changes in wider and large scale. After this prove successful, then they have to sustain these changes by simplifying the process, by standardizing the process and make important protocol. This should be documented and at the same time should be part of the institution policy and procedure. And if the staff need training in certain area, they should be trained. One of the method of quality improvement is root cause analysis. We have discussed this before in incidence analysis. This is a multidisciplinary team. The root cause analysis effort is directed towards finding out what happened, establishing the contributing factor for the problem. Mainly, we try to identify system factor, latent factors that can help to solve the problem, and then we can make suggestions and solution. This can be implemented through different methods like flowchart, cause and effect diagram, Pareto chart, run chart. In flowchart, we map all the process. You have a team uh, to map the patient process from the first interaction till discharge. And as you see here, they map the process in the outpatient clinic, then during through the admission office, in the medical ward, the theater, recovery room, and then in the ward till discharge. And then they can plan intervention at appropriate phase. In cause and effect diagram or fishbone diagram, here we analyze the problem based on social issues, staff attitude, complications that can happen to the patient, post-discharge support, patient perception, procedure. So in each of these domain, we try to find different factors that can contribute. This is about an intervention done in one hospital to reduce the length of stay following colostomy. And the patient used to stay for 14 days and they tried to reduce the hospital stay to 4 days. They utilize multidisciplinary team and they use a lot of intervention, and all this has led to good success. In Pareto chart, there are few activity can result in a lot of outcome. So it's what we call 20-80 relationship. 20% of your activity can result in 80% of your outcomes. So those few, if we identify them, then we can implement the appropriate measures. It can help us to select which problem need intervention. Run chart can tell you about your performance. It helps you to see where you stand and if the intervention produce significant measurement. So after that, then we have to have strategy for sustaining improvement. Um, you have to document this in the same intervention for reducing the length of hospital stay. Then they document and report each patient outcome, and then they measure the average length of stay. Then they show the chart in to all stakeholders in the OR, for administration in the ward, and team. They meet every 2 weeks, and then they correct their intervention. After they do continuous refinement of the clinical pathway, then they implement in wider scale, then they disseminate, then it become hospital policy. Take home quality improvement methods and tool improve patient care and reduces errors. Methods and tools of quality improvement need good teamwork and collaborative effort. Measurement of real improvement should be documented and sustained. Simplification, standardization, and governance through policy and procedure will sustain the improvement. And thank you.